it's Dr. Hsieh with Drop Therapy. I'm here to talk about how to use Kinesiotape in your child with urinary incontinence. Recent research has shown that using Kinesiotape in kids that have urinary incontinence helps to decrease the frequency. The theory is that in addition to just the sensation of bladder filling internally, using Kinesiotape externally over where the bladder is on the body in the lower abdomen, they're able to have an additional sensation input into bladder filling. So as their abdomen stretches, because their bladder is getting fuller, the tape stretches over their skin, and they're able to kind of sense that as well, and hopefully take themselves to the bathroom at the right time. The research studies using Kinesiotape in incontinence for kids recommends using the tape at least once every 3 days. I would use it depending on how often your kid has accidents. So if your child has daily accidents, I probably would recommend changing it daily. If they have it just kind of once in a while, just a couple times a week, you can leave the tape on for a full 3 days and then just change it every 3 days. If you decide to start Kinesiotape on your child for bedwetting or daytime accidents, I would recommend purchasing the Kinesiotape online. We get ours off of Amazon. This is the brand that we usually get, Kinesiotepe Gold, and it comes in a large box with a roll of the tape. And what I would do would be to cut them in 3-inch strips. You want to cut it into thirds. So cut about 2/3 of the way up with a bit of the tape still together at the top, and you'll have these 10. So where we want to apply the tape is right below the belly button, right above the pubic bone. That's where the bladder is located. We take the backing and we just want to take the top part of the backing off so that it's easier to attach right underneath the belly button. So that's Lulu's belly button right there. We want to apply it just below that belly button right there to clean skin. So it's the best right after they bathe and they're dried, no lotion on their skin, so it makes the adhesive stay on a little bit better. There is some stretchiness to the tape, and I'll show you here as I take the backing off one of the thirds. So you can see here, there's some stretchiness to the tape. You don't want to apply the tape so it's totally stretched out. You want to apply it so maybe it's about half stretched out. And you want to apply the tape in an M underneath the belly button. So this first one is just going to go on the side. And the second one is going to go on the other side. A little bit of stretchiness and pulling it down. You might have to adjust the length of the strips if your child is younger, so that it doesn't go all the way down to their pubis. And if they're really tall, then you might have to make them even longer. So again, a little bit of stretchiness, just going about halfway and down to about her pubic bone. So we're applying it in a little M shape here. The easiest thing to do is to do it after they bathe. So if you want to do it after they shower every day and then take it off the following day and then reapply it after the shower, that's the best way just to be consistent with it. You can also take it off with using a bit of cooking oil. We use olive oil in our family, just putting it to the top of the tape so it's used as an adhesive remover, and it makes the tape come off a lot easier. I would recommend using the tape at least for a full month, if not up to 3 months. The more consistent that you are able to have your child use the tape, the better the results. So really just kind of getting into the groove of changing out the tape every night after their shower is probably the best thing, just to make it a habit. And you'll find over time that they'll start having a little bit less accidents. I hope you enjoyed our video today. If you have any questions or comments, just leave them in the comment section below. or you can always direct message us on Instagram at The Drop Therapy. Visit us on our website at thedroptherapy.com, and have a great day.